Thanks to all the volunteers making this happen. And welcome to the first upstairs session, Health Impacts of Heat and Compound Events. Our first speaker, could we lose Chris? Is Chris Uejio of Florida State University and HAQAST member, returning HAQAST member.
Thanks, Jeff. Hi, folks. Pleasure to see everyone. I had a chance to say hi to everyone again since arriving. Anyway, sorry, just to jump into it. Earth observations and heat mortality. We do have some actual some work on compound events. I've chosen actually not to show something slightly different, but partly just because it shows what our project will be working on going forward. Okay. As many of you know, extreme heat is the #1 weather-related cause of death in the United States. So estimates vary, but something along the order of 12 or 14,000 excess deaths in the United States per year. So that is excess rate. That doesn't mean that on the coroner's death certificate it says they died of heat, but really there's a variety of other conditions, many that we still are just learning about now, that are in excess of what we would normally expect. Anyway, so just for the air quality folks, like that's on an order, a similar magnitude as the number of people in the US that we suspect to die from wildland fire smoke, excess numbers. Okay, so local governments are at the forefront of adaptation resilience plans, and I think at future meetings we'll hear more from them about some of their awesome work that they're doing. I just wanted to talk a bit about needs, really. So chiming in a bit with what Tracy talked about earlier, what are the gaps, particularly as it comes to Earth observations for this field? So this was a survey not not funded by my group, but I also often cite them. This is Lad Keith's group, and then Archie et al. That was just published in Climate Services, but one of the most comprehensive surveys of planners across the United States. You can see where they've surveyed the actually orange triangles are interviews, as well as surveys. And they essentially said, what do they need? In which case, the #1 response in terms of data needs was locally updated heat exposure maps. 80% of respondents. So big, huge need again. I didn't pay them to come up with this finding, but nonetheless huge for NASA Earth observations. Here, these also relevant for NASA Earth observations, nature-based solutions, land cover inventories, public health interventions, parts of our projects. Okay, so sorry, jumping back to Earth observations and heat mortality in Las Vegas. Many of you, so I grew up in Southern California, so I've been to Las Vegas more than I wanted to. Growing up, that was our like middle income person's like vacation spot, right? Anyway, but many of you are probably also somewhat familiar with Las Vegas, and this is Clark County. Not to go too much into the workflow, but essentially like Chu, University of Alabama Huntsville, who has designed this workflow, we're combining both private weather stations, which, there's hundreds versus a few sort of first order weather stations in a city of this size that pass quality assurance and control checks. We'll combine it within NASA's EcoStress satellite as being sort of our primary driver here. It has a higher spatial resolution, more frequent overpass time because it relies along the International Space Station. So at least until about 2030, so we should still be able to continue to get these estimates. And some of the innovations are, instead of land surface temperature, surface skin temperature, like if you literally put your hand on the pavement on a hot day and it's really hot. And if you look at those maps, sometimes you'll see like some really insanely, maybe implausibly high temperatures. What we're doing is actually trying to transfer that more to surface air temperatures, which are still hot, right? Don't get me wrong, but are perhaps less variable block to block, but still vary within a city to a notable amount. And then from there, more on my side, like what we do is try to relate that to the adverse human health outcomes. In general, extreme heat mortality is underreported, and I think that's still probably even true in Las Vegas, but they've made a really concerted effort, Las Vegas, as well as sort of Phoenix, Arizona, Philadelphia, a few other places in the nation, to accurately document, or at least increase the portion of deaths that are actually prescribed extreme heat. As I'll show you, so they actually have one of the highest rates of classified heat mortality in the nation, as you would expect. And obviously, for those of you on the environmental side already know, it's one of the places that's warming up the fastest in the United States. Okay, so we're just going to combine these heat mortality records, translate the land surface temperature to air temperature, and look at the characteristics of the places that disproportionately suffer from extreme heat. So what do we see in terms of just counts over time? These are counts of these deaths. These are for each of these zip code tabulation areas. So some of them obviously have bigger contributions over time. But the main point from this is it's going up, right? As we'd expect with higher temperatures. So sorry, I didn't extend to 2024. We extended the analysis then. But you actually see that for 2024, this past summer has been, for 25 was cooler, 24 was really hot, right, as many of you know. Okay, and the deaths were also increasing in that year as well. Just to get some very exploratory information, if you want to figure out where are the places that are consistently above average, you essentially get this corridor here in Las Vegas. As Las Vegas, very, very dry desert. If there's a tree there, it has to be irrigated by a human, pretty much, right? Unless it's in a wash. It's not like there's natural like tree cover. Anyway, so we have these areas that we know of. I won't belabor this or go into too much, but happy to explain more later. But essentially, we can get some generally understand a fair amount of variability in death rates based on heat exposure and the sociodemographic characteristics of those places. So this is a spatio-temporal model, but we can capture those trends over time. They're increasing to 2023 today. Some of the demographic things, some of them might seem counterintuitive at first. For example, in Clark County in Las Vegas, Nevada, that older adults did not have higher death rates, but this is on the neighborhood level, not on the individual level. So if you're looking at the neighborhood level in a place like the desert Southwest or a place like Florida, that's areas with higher proportions of older adults are really going to be like retirement communities, not necessarily individual older adults living alone. Okay, and then some of the other things, living alone, poverty, moving, outdoor workers, linguistic isolation, Black, Latino, Hispanic having significant increases in mortality risk compared to white zip code tabulation areas. This is a bivariate chloroplath map, which sounds like a horrible word soup, which some people really hate. But anyway, it's trying to show the overlay between both areas with high mortality and high risk factors. So essentially, the point being these purplish areas have both high deaths and sort of align with that risk factor. And we can generally see some of those key high risk areas sort of pop up in those maps. So this is an example of one of the types of things that we're hoping to do with our project going forward. We're going to be focused more in the southeastern United States, but we do work across North America. It's a little bit different than some of the other places where we work. We've worked with Miami-Dade County and some other places, New York City, where they have sort of like clear public policy guidelines that they're basing some of our outputs on. Here, there's not necessarily a local health person who's championing this cause. The legislature only meets every other year. So they are pushing some heat-related safety bills, but it's not going to be at the pace that heat is affecting this area. Anyway, thank you very much for your attention.
Thank you, Chris. Oh, I forgot to mention the format. So we'll have 4 about 10-minute talks, and then we'll follow it up with a panel. So questions will be aimed at the panel as a whole. So you can just jot down what you want to ask. So our next speaker is Kilan Bishop, who's at the University of Miami.
Hello to those who I've met. Nice to see you again. To those who I haven't, nice to meet you for the first time. My name is Kilan Bishop. I'm assistant professor at the University of Miami, Rosenstiel School of Marine, Atmospheric, and Earth Science. It's so long. It's RASMUS for short. My lab is called the Environmental Justice and Health Equity Collaborative, so I've been having a lot of fun since November 2024. All right. And I'll be talking to you all today about a qualitative study that I've done in collaboration with some folks who are more on the Earth system science side that we coined When It Comes to Heat, I Retreat, based on a sentiment that was shared. So I come from sunny Miami, Florida. And as Chris mentioned, in the context of, other health threats, extreme heat is the number one in across most of the country. Heat hazards are more acute in Miami. Really Myra Cruz, Lene Turk-Hankins, Nkosi Muse, and Katie Mock have been working on a definition of chronic humid heat, which is more what we experience. So heat doesn't necessarily come in waves. That's the name of the paper, where heat doesn't come in waves. It is persistent, and so the risks, especially the health risks, are much different. Our study kind of started with Earth systems data and then went more qualitative. And basically, Nkosi, who I just mentioned, was looking at land surface temperature as a proxy for heat exposure in Miami-Dade County. Really, the major finding here was that there are inequities in hyperlocal or neighborhood level heat exposure in Miami-Dade County that's not captured by measurements from regional weather stations. And so then Lene, with the help of Myra and Nkosi, our Miami superheat trio, as they're coined, conducted a study of indoor heat exposure among 57 households in Miami-Dade County. They deployed heat and humidity sensors inside people's homes and found that there were various different resident characteristics, economic, housing characteristics that were captured in their data set. However, among 57 homes, you're not gonna necessarily be able to like zero in on one thing. I'm a health scientist, so I was super interested in the mental and physical health conditions that were captured in their data set, and I wanted to learn more about how medical vulnerabilities were impacting people's experiences with heat, and how people were adapting to that. So we set out to explore how heat exposure impacts people with cancer, both their quality of life and also their access to healthcare. Why cancer, you may ask? I'm a cancer biologist. I probably should have led with that. So also, cancer hands down has the best health data. If you've met Leticia Noguera, she'll tell you that. We have registry data, so and there's a lot of like longitudinal studies that are easy to recruit from. Yeah, so that's what we did. We recruited from several cancer-related registries and longitudinal studies at the University of Miami Miller School of Medicine. Easy for me because I got my PhD there, so I just had to tap back into my mentors. We included anyone who was 18 years or of age or older, a resident of South Florida, anywhere in Sylvester, our cancer center's catchment area, and anyone who had a history of cancer. For those who are unfamiliar with cancer as a disease, that is anything from diagnosis to remission. So they could have been recently diagnosed, under active treatment, or just a cancer survivor, but cancer survivorship starts from the time of diagnosis. So data collection looks kind of like this. So this was all during like COVID. So we called people on the phone instead of recruiting in the clinics, did a telephone screen that was basically like, are you 18? Do you have a history of cancer? Would you like to participate in our study? Once they said yes, we consented them in and did a semi-structured interview as well as a survey, which was administered as a verbal questionnaire. For the study, we ended up recruiting 20 participants across 18 zip codes and among 2 South Florida counties, which is really Miami-Dade and Broward. I should have a slide on how many people we called that were like, heat. I don't want to talk to you about heat. I have other priorities. So there was a lot to navigate when it comes to people wanting to participate. There were people, just to honor the population, there were people who I called who had transitioned. And so, you know, their family members are answering and navigating a lot of grief. So much love to our 20 participants. We were able to, despite the challenges, recruit among different varied age groups, employment statuses, homeowners, renters, and people who had various different concentrations of residents in their home. And we did a thematic analysis of the interview data that led to the following key themes. So heat interacts with health status to adversely affect quality of life among people with cancer. Some of you might be like, duh, like, obviously, if you have a health condition, there's going to be health impacts. Not necessarily true. A lot of studies skip straight to mortality. And if we looked for mortality in this population, we probably wouldn't have found it. If someone with cancer dies, it's not usually coded as because of heat stress. And so we really zeroed in on what people were experiencing. Anita, a participant from Miami-Dade County, shared that one of the first conversations after she had a heat stroke was the physicians telling her, like, I can't have heat exposure with my medications. Some of them bring out rashes, hives. So after she had this interface with the healthcare system, she was like, yeah, no more sun for me. which really translated to no more outside. That was the most salient finding. People just went, I mean, they literally turned into hermits, and were reporting 20 to 24 hours spent inside every day, leaving pretty much just for health appointments. That was because they had these increased cooling needs that resulted in significant lifestyle adjustments. So Leon, another participant from Miami-Dade County, said that he basically had, and many of our participants had other comorbidities, and heat exposure was just a risk that they weren't willing to take. And so people who even enjoyed time spent outside or wanted to go sit on the patio were like, if I have to make a choice between having a hospital visit or just staying inside, we're just gonna stay inside. There were also, so that's more of a social reason to stay inside, more of an exposure related reason. There were also financial reasons. Costs related to constant cooling as well as medical expenses led to very little money for recreation. Patient-provider communications emerged as underutilized opportunities to both discuss heat risks and also discuss how to enjoy outside as a person with a medical vulnerability. Anita, who you may remember, shared the doctors were telling her to walk every day. Physical activity leads to better cancer prognoses. She was like, there are no parks. Once again, I'm not doing outside. And so she was like, I just don't get any exercise because not worth the risk. And the other thing that came out was that social support facilitates heat adaptation. So Ray, another Miami-Dade County resident, keeps his AC on like 62. I don't know what y'all keep yours on. My AC is on 78. It literally is humidity control. He reported that his wife was always freezing, and there were a lot of reports of people making their family members, friends making sacrifices to accommodate their increased cooling needs. So in South Florida's tropical climate, people with cancer are experiencing heat exposure as an unavoidable burden and staying cool as a necessity despite financial and social costs that are actually counter to their cancer prognosis. In response, patients initiated lifestyle changes such as limiting time spent outdoors, moving doctor recommended physical activity indoors if they could, and trade-offs to manage the elevated costs of medical treatment and cooling. What was interesting is conversations with healthcare providers often shifted the burden of avoiding heat exposure to the patient. So basically, whatever you got going on at home is your business, right? Future direction. So because of that, a couple of things emerged from here. One, participants are reporting most of their days spent indoors. So that preliminary study about indoor heat exposure became really important. We want to know in the next iteration of this, what their actual indoor heat exposure is, how that's impacted by their cooling capacity. And naturally, that's led to some questions about indoor air quality, since that is where they are spending most of their time. The other question that came up is, how can we provide physicians with digestible neighborhood level environmental data that would populate in an electronic health record when you look at a patient address so that they can provide climate responsive chronic health disease management recommendations? And also, how do we think about advancing and evaluating the impact of energy policy that considers medical vulnerability instead of just income or age? For those, I'm pretty sure I'm running out of time. Great. For those who are unaware, the burden of cancer is shifting to younger and younger populations. And so even if you are not 65 plus, then you have, and you're a person with cancer, then you have these increased cooling needs and you don't necessarily have the support. And for those of us who have never experienced being low income, cancer will very rapidly make you low income. Even if you make a lot of money, it doesn't matter if you spend a lot of it as well. We'll spend my final 30 seconds acknowledging the people who made this research possible, including the Thread Collaborative, Doctors Amy Clement and Katie Mock, who supervised me doing this work when I was still a postdoc, their graduate students, now doctors Lene, Dr. Nkosi, Myra, as well as Austin, they do more of the quantitative heat stuff, except for Myra, it's my social science girl. Some collaborators in the University of Miami School of Education and Human Development, my mentor from the University of Minnesota, our community-based collaborators, as well as the HBOC lab, the Miller School of Medicine-based group that allowed me to recruit from their patient population. This work is available as a preprint. That's the QR code if you're interested. Also, if you just Google, "When it comes to heat, I retreat," preprint, it comes right up. Thank you.
Thank you so much. All right. So our third speaker is Adam Schlosser from MIT. Moving from 2 Florida speakers to 2 Massachusetts. Hey.
I'm the first of a double dose of Massachusetts. So good morning, everyone. I am supposed to advance the slide, sure enough. Yes, there we go. So good morning, everyone. Unlike the prior speakers, I'm sure that I am unfamiliar to most of you here in this room. But still, I'm a first timer for HAQAST and happy to be here and look forward to talking more about what I'd like to share with you today. My hope for the next 10 minutes is not necessarily to give you any sort of a specific research result, but really to kind of step you through a platform, a data visualization platform that very much speaks to this issue of emerging, coexisting, co-evolving risks across different landscapes. That's sort of where my center that I sit at, which I'll get to in just a second, sort of thinks a lot about. So quickly, I sit in what's known as MIT Center for Sustainability Science and Strategy. We are very much a modeling and analysis group, and that sort of actually is an important sort of underpinning for how we've developed this visualization platform, but how we'd like it to apply it to HAQAST, which I'll get to in just a second. But in that top right schematic, what's sort of the real important takeaway message is that we have a number of prediction tools that sort of sit in the human, societal, Earth system space. And at the end of it, what we would really like to do is to talk about human and planetary well-being health. So that's really sort of the ultimate goal of our project. And as with any effort to model and predict a very complex system, I'm sure you can all appreciate that as you add more complexity, more detail, specifically in the prior presentations that you just saw, as you get down to really high granularities, the computational expense that goes into these models gets really, really high. And so this visualization platform got its start by thinking about ways that we could sort of efficiently combine data to give you sort of a triage-based screening of where we think co-evolving or coexisting risks may be already, or maybe there's only sort of, 9 out of 10 of these ingredients that are there, but there's one more that may really sort of provide a tipping point in the future. And how do you sort of identify these areas where then you can focus these more detailed models that, again, very computationally expensive to run, but this gives you, again, sort of a screening, sort of efficient level of honing down where you actually want to go. So with that, we built this sort of, again, this triage approach. And the idea was to combine any sorts of data, metrics, observations, you name it, that I think you can all appreciate in the work that you do, isn't very harmonized, isn't very homogeneous. And so the idea is to sort of put together a metadata collection, use various normalization methods and QA to sort of quality control and quality assess the data, to provide a platform that gives you sort of a unified description, at least in terms of the landscapes, of many different variables. And again, this goes across not just health, which we focused on a lot here, but also issues of land resources, water resources, socioeconomics, infrastructure, the whole gamut of what you might view as sort of the integrated system of systems approach to predicting. And so again, the idea wasn't on stage one was to do a collection of all this data to give a sense of the contemporary environment, with the intent eventually to look at predictions. And so in doing all that, we've put together this platform, and this just kind of gives you an example of what this platform looks like when you visit it. I encourage all of you, please give it a try. We would love to hear feedback. This is a work in progress, and I'll get to this in just a second where it fits into HAQAST. But this is a work in progress. So any feedback that we can get, not only from scientists, but from end users, how we can make this better is obviously very welcome from our team. But that being said, there is a paper actually that's listed here that sort of gives at least the methodology of how we put all this together. There are various aspects of this platform that I don't really have time to get to specifically, but just to give you an example of what you can do. You have a number of sort of what we call combinatory metrics that you can start with. So for example, again, given that the nature of this workshop, What if you're interested in air quality exposure? What if you're interested in air quality exposure to other risks, such as water quality or water stress or temperature stress? What this platform allows you to do is just to sort of sequentially go through each one of these sort of landscapes of hazards, risks, exposures, and begin to combine them in a way that you can look at, you can arrive at hotspots of where all of these conditions intersect. And again, with the data that we have, you can start looking at things like demographics, employment, how do not just these sort of physical risks, if you will, but transition risks. And in the industry, they're getting very interested in termination risks. How do all of these overlap and potentially would co-evolve? Within this structure, and I think this also speaks to, I think, a real opportunity here for HAQAST and our engagement, is that anywhere along the line, you can zoom in. So as in this example, and I put this together yesterday, and it said, again, it just sort of represents the efficient nature of this, is you can zoom into any state with this depiction of the US, and the normalization will reshuffle itself and recalibrate itself to the state. So what you're looking at in that state blow up is the hotspot based on all the counties within Missouri, not the US. And then from that, you can actually get a report card for a particular county of interest. And again, this is all the nuts and bolts are here in this platform. It's really just about populating data that we think is useful and provide a nice opportunity. So with that, I just wanted to hopefully leave you with a couple of talking points that would be useful, hopefully, for Q&A. As I mentioned, this platform, we right now have it set up to look at county level data over the US. We also have a global platform that looks at the national level data. There's a real reason why we've set up these units of spatial visualization the way we have. And it's simply because our model predictions sit at the county level, the US level, and at the national level. And when I say our predictions, I'm talking about not just Earth system predictions, but economic predictions, socio-demographic predictions. How do we view all these risks? That being said, we are working with counties within Massachusetts, the Essex County Foundation, for example, and we're beginning to look at these visualizations at the sub-county level and at the city-by-city level. So some of the talks that we just saw, these are the sorts of data that I think, again, will provide a real opportunity for us to expand this platform. And with that, I'm working with Arlene Fiore in the HAQAST and her HAQAST project to not only do that, but to enable these visualizations to receive satellite data. So again, a lot of the data that we're all working with here can be put into this platform. We currently can convey current conditions. We are, as I speak, putting in our initial set of future projections for our model predictions. We do not have anything in the area of air quality, so other sessions that we have about predictions, be very happy to talk about that and see how we can engage all of that. And again, ultimately, this is just to sort of look at, again, these sort of compounding exposures and risks and to provide actionable information. So with that, I encourage you all to give it a try. I'd be happy to receive feedback, and again, looking forward to the Q&A. So thank you.
All right, so now we're gonna check our technology because we have an online talk from Xingmei Liu from the Massachusetts Department of Environmental Protection. So thanks, Kara, for.
Okay, thanks so much. So hi, everyone. I'm Xingmei Liu. You can call me Sherry. I'm from Massachusetts Department of Environmental Protection, Bureau of Air and Waste, Air and Climate Division. And I really appreciate the invitation to be part of this panel. And unfortunately, I couldn't be there in person. I'll briefly share how our cumulative impact framework supports assessments of overlapping environmental and health stressors, and how we are beginning to explore heat as an emergent component. The CIA requirement was finalized in 2024 as part of Massachusetts air permitting regulations, specifically 310 CMR 7.02 Part 14. And the goal of CIA is to evaluate existing environmental health and socioeconomic conditions in or near EJ, environmental justice, populations when new air permits are proposed. It provides a structured, data-driven way to understand local community conditions and potential incremental impacts from proposed projects. This framework is one of the first of its kind in Massachusetts to bring multiple data domains, air quality, health, demographics together into one consistent analysis. It helps permit engineers and analysts view the contents of existing community burdens before new emissions are reviewed. And our framework organized data into several categories. First, air quality and climate indicators. These include PM2.5, ozone, diesel particulate matter, traffic proximity, and cumulative air toxic matrix, such as cancer risk and respiratory hazard index. We also include land use and facility indicators like impervious surface and proximity to regulated sites, including air facilities, waste facilities, and TRI sites. For population and health indicators, we look at asthma prevalence in schools, grade K to 8, blood lead, low birth weight, premature death, COPD, and heart disease. Sorry about that. So for social indicators such as income, race, or affinity, language isolation, and age structure to reflect community vulnerability. And finally, we consider sensitive receptors like schools, child care centers, long-term care facilities, public housing, and prisons. These indicators bring together, provide a comprehensive view of existing conditions within EJ communities. We're not just looking at air pollutants in isolation. The real value is seeing how exposure indicators, health outcomes, and vulnerability factors intersect spatially. So while heat is not currently an official CIA indicator, we're exploring how temperature or heat exposure data could be integrated in the future. We're looking into using PRISM daily maximum temperature data to calculate the number of days exceeding 85 degrees Fahrenheit as a preliminary metric for heat exposure. This helps us to identify areas that may experience higher heat stress, which often overlaps with vulnerable populations and higher pollution burdens. We are also considering satellite-derived land surface temperature data as complementary sources. This is still exploratory, but it aligns with ongoing efforts to understand compound stressors where heat and air pollution together may increase health risk. So far, we've explored several different ways to measure heat exposure. This map shows the heat-related hospitalization rate across Massachusetts at the municipality level. The data source for this map is the Massachusetts Department of Public Health, MDPH. The color scale goes from blue to red, representing a lower to higher crude rate of heat-related hospitalizations. The gray areas indicating missing or suppressed data, where information was not available or did not meet reporting threshold. As you can see, it's difficult to identify a clear geographic pattern of heat exposure based on this data set, largely because of the amount of missing data and the variability between municipalities. And the next map shows the heat-related emergency department visit rate, also at municipality level. The data source is again MDPH. Compared to the previous map, you can see that gray areas are more extensive, which means that there are even more missing or suppressed data points for emergency visits. This makes it even more challenging to interpret spatial patterns or draw conclusions about heat exposure and its health impacts from this data set alone. And next, this map is displaying the average number of days between May and September from 2019 through 2023 in which daily high temperature exceeds the 90th percentile of historical highs. The data comes from National Environmental Public Health Tracking Network via CDC. The data are shown at block group level, which provide a finer geographic resolution. From the map, it appears that the areas such as Cape Cod and the islands experience a higher number of these hot days. However, it's important to interpret this cautiously. This pattern may not reflect actual heat exposure across the state, since it doesn't show urban heat island effects or localized environmental factors. So building on our exploration of heat exposure, this map shows the number of days in which average daily temperature exceeds 90°F across Massachusetts, May through September 2022 to 2024. The data come from PRISM from Oregon State University at an 800-meter resolution, which provides a much finer spatial detail. Because this is a raster map, we can better capture local variation in temperature, including areas that may experience higher heat due to urbanization or geography. Overall, this measure is likely more realistic for assessing heat exposure across the state. And after consulting with MDPH, we decided to go with 85°F. So this is showing the count of days over 85°F across Massachusetts at the block group level between May and September from 2015 through 2024. What it does show is regional variation in heat exposure patterns give us a sense of where higher temperatures tends to occur. Looking forward, we plan to evaluate how these data sets can be integrated with existing environmental and health indicators to support future analysis of compound exposure, such as heat combined with air pollution or social vulnerability. So currently our cumulative analysis relies entirely on ground-based and modeled data sets from agencies like EPA, CDC, Mass DPH, and our own agency, Mass DP. We haven't yet incorporated satellite data, but we see significant potential in doing so, specifically for pollutants and temperature matrix, where statewide coverage can vary. NASA's dataset could help us to improve our understanding of regional patterns in air quality and heat exposure. Our goal is to work with research partners, including HAQAST, to evaluate how these data sets can eventually be validated and integrated into future versions of our framework. So thanks so much for the opportunity to share our work. And Mass DEP's cumulative impact analysis provides a foundation for understanding multiple environmental and health stressors in EJ communities. As we move forward, we'll continue refining our methods and exploring ways to incorporate additional indicators like heat and collaboration with research partners. Thank you.
So we have about 35 minutes now for open discussion. Don't know if anyone wants to kick it off.
Oh, I thought.
And you also can ask each other questions, but there's a few in the crowd. So we'll go with Jen and then Arlene.
Hi, Jen Kaiser, Georgia Tech. My question, I think, is for Chris, but maybe also on a visualization standpoint. I'm wondering how variable the relationship is between land and air temperature, and is there a vision of having a high resolution air temperature map the way we have land surface temperature, or do we think coarse resolution would be fine since there's not a strong?
Yeah, great question. So it depends on the municipality, but in terms of like order of magnitude, it can be like 8, 10, 16 degrees Celsius Kelvin off in terms of the two metrics. In terms of covariation, it's also off, or correlation across space. That being said, I mean, I think my first, like the high level message is that they're different and the health studies mainly use air temperature. But that being said, I don't want to completely throw out land surface temperature. I think there actually could be some utility for pedestrian level work, just because you are getting some of that multiple reflectivity. I think it still contains some information that could be useful. So even though I mainly pitch one, there's a little more nuance there. And then there are a couple groups. TC at Pacific Northwest Laboratories has a US, and maybe US, certainly US wide product, at least CONUS wide product of air temperature for the large cities, in which case that's really only where you need it, since everything else you can use PRISM or DayMat or some other NASA product, Mara, et cetera.
So I have, I guess, a specific question for Chris about Las Vegas, but then I was hoping to hear more about the distinction that Kilan raised about chronic exposure to heat versus like event exposure. And I wonder if that, like, at what point does event turn into chronic and, sort of, I guess, sort of, is this something that's fundamentally different about Florida versus Massachusetts thinking about heat? So that's kind of my general question for the panel. And then, Chris, I was just really struck by how in Las Vegas, 2019 and 2020 were low years. Were they just cooler years, or was there something different going on then?
Yeah, great question. Sorry, I shouldn't turn that off. I think they were generally cooler years. I think if we had a longer time series, I would at least maybe not even quantify it, but at least map the temperature on that. But I think it generally tracks that. Why we chose that study period partly is because actually both eco stress and the private weather stations, but mostly the private weather stations, they just really blossomed after 2017. And then the second consideration being it's both medical examiner and a coroner, which I know is getting into the weeds of this, but they actually count deaths differently, which I know for a general audience is not readily apparent. But there was one person who did that continuously over that period of time, so I had much more confidence that that was not the reason why that was changing.
I feel like you can also answer the second half.
I think it's good to have that. That's okay.
I don't know that I'm the right person to answer the question of when does chronic humid heat or when does acute heat exposure become chronic humid heat. What I will say is that in Miami specifically, there was a push to raise to lower the National Weather Service like emergency thresholds because we were experiencing extreme heat and there was no heat warning. There was no heat advisory being issued. And so I don't know that there's like, I know for a fact actually that there is not, that question doesn't have like a solid answer yet. I think it just comes down to regionally, like what is happening and when are there, and Chris has done some of this work, like when are there specifically health impacts related to heat exposure? And for Miami, that was not being captured by the current thresholds. There's also just honestly, Miami has a tropical monsoon climate that there's not a lot of other places in the United States that share that. And so Miami is, let's say, in community with a lot of global places versus places in the United States in our experience of chronic humid heat. But I don't think that that's going to be the case for very long because of climate change.
Okay, so I'm going to give the classic scientist response to a question by answering it with more questions and more complexity, but here it goes. I think one thing that strikes me with all the presentations that we've shown today is that I think every one of us probably had a different metric of extreme temperature. And so I think that's very telling. So I think to your points, I think it's sort of a case-based, impact-based, location-based issue. And that's really the challenge here when you're trying to put together some sort of a unified mapping system of impacts and risks. It just gets really complicated. And just to add another perspective to this is in our construction of the platform that I presented, again, we have sort of a holistic impression of risk. And when I say that, I mean, so when we think about transition risk, there's also actually an opportunity. And why would I say that? It's because when you look at heat impacts, they're not all bad. Particularly when you think about the world. When you look at heat impacts, particularly with something like labor productivity, there are actually places in the world where labor productivity goes up. And you can probably imagine where these places are. And I only just say that because I think as a community, when we put together these visualizations, obviously it's important to convey the risk and the threats. But at the same time, I think given what I feel like is the spirit of HAQAST, and again, I'm new here, so maybe I'm way off here, but what I feel like is the spirit of HAQAST is that I think there's also an opportunity here for us to, as scientists, to provide insights of where the opportunities are, where can we think about shifting things where perhaps the environments are more favorable to certain activities. And so I'll just leave it at that.
And I'll follow up by saying that where, to your point, where my say conceptual framework for people with cancer is like there's like a very limited like comfortable thresholds, right? Where they're not physiologically stressed by the environment. But if one had to choose, it's easier to manage cold exposure than it is to manage heat exposure, right? That's not the case with other medical vulnerabilities. So I have a postdoc who's interested in vascular-occlusive crises from sickle cell disease. In that case, cold is bad. Because there's like set links between or there's established links between the frequency of those pain crises and emergency admissions among people with sickle cell, and she's now trying to understand like what happens in chronic humid heat in those populations. Maybe nothing, maybe everything. And so we've had a couple conversations. She's writing a commentary, so swiper no swiping, but we've had a couple conversations about how there may just be climates that are amenable to certain populations, and we probably have to start having more thoughtful conversations about climate migration, ethical climate migration, rather than focusing simply on adaptive capacity, which is patterned so much by local government action or Florida inaction.
So to your point, that's a remarkable opportunity. So, I mean, for me, as somebody trying to convey information of, say, I mean, to your points, it's all about the threshold. Where do you cross that threshold where, to your point, to that specific sort of risk, where do you cross that threshold, and when can you actually tell people, look, this is when you have to start thinking very carefully about your condition and how it relates to the environment that you live in or that you may not be living in. So in terms of that research that you mentioned, knowing what that threshold is critical. I mean, we have all the data. It's just knowing what the thresholds are.
Xingmei, I just want to make sure you have the opportunity to jump in if you want to add anything.
Yeah, I just want to say, like, I want to echo all the other speakers said. So I feel like Massachusetts is one of the states in Northeast. So we're setting different thresholds than the states in the South states, and the temperature we experience for extreme heat might be different for the southern states as well. Yeah.
So I have a question, unless there's one more in the crowd. So I noticed I'm almost sure I saw it in Adam's maps, and perhaps I could see it in Xingmei's maps as well, and you may all have thoughts on this. So we're dealing with quantitative data where we're trying to get specific exposures where things like Earth observations can help, but we're also dealing with reported data from people. And one of the things I often notice when there's reported data and there's a map of the US is you see state borders pop up. And it's like, there's a farming in this part of Illinois and there's farming in this part of Missouri, but they're probably not all that different, but then you see the border. And I often wonder, is like, this is just states being different with reporting, and perhaps even in Massachusetts, there's different counties, different cities and stuff that have different standards, different protocols for reporting. And so when you're working with trying to understand health data and you're working with this quantitative data, that's both exposure-based, but also health reporting based, are there challenges in that when you're making mapping or trying to give warnings and those sorts of things?
Yeah, so you picked up on that. So that particular example that you saw probably was when you went from the air quality metric that we used to adding the water quality metric. And so that water quality metric actually came from EPA, from their, can't remember what their database is, but they, very much to the points that we were talking about with heat stress and in heat extremes, they had a whole, recipe and menu of different metrics that we could use. And we spent a lot of time looking at which one to choose. And to your point, there were very clear distinctions, very clear state boundaries in that metric. And when you normalize it, so one important subtlety to that mapping is that you're looking at relative levels of risk. So one perhaps misleading visualization feature to that mapping is that you might see hotspots, but it could be that in an absolute sense, everybody is exposed. So in some sense, to your point, the sort of the state border distinctions that you see, we aren't quite as concerned about, because these mappings aren't conveying absolute risk, they're conveying relative risk. And so what you're really trying to look at is, where do we want to focus our attention, rather than this is the absolute risk of that exposure. But to your point, what we would like to do is to add another option to this mapping, where we go from the relative mapping to some sort of standardized risk mapping, like, a factor of 1 to 5. And that's where all of your issues are, I think, going to really surface when we think about how we actually are going to remap all of those numbers. But yeah, good point.
Yeah, thanks.
I
so-
wanted,
Yeah,
sorry.
go ahead, please.
Yeah, so I wanted to add a couple points for my map, because I'm only looking for Massachusetts. So I probably don't have that many issues for variation between the state, but we do want to focus on smaller communities. So our finest resolution would be at census block group level. And a lot of the health data are only available at census tract level, which we can still deal with it. But we do want to have data as refined resolution as possible.
Yeah, thanks. The one thing I noticed in your maps, and I'm biased because I grew up in Western Massachusetts, so every time you showed a map, I was looking at Western Massachusetts. And I know you said you didn't have a lot of that you could take from the health data first for heat. I don't remember his hospitalizations or mortality, but the Berkshires were showing up. Some of the Berkshire counties or tracts were showing up as orange, and then it was unsurprisingly the coolest place in the state. So I just thought it was fascinating. It could just be low populations in those places. Is that right?
Yeah, I think you're right. I think it's also they may tie it back with the social vulnerability, some other effects as well.
That
So
makes
it's
sense.
not just heat exposure alone. So that's
That makes a
why
lot of sense.
we are also interested to see to combine with other factors.
Thank you.
Hi, I'm Shravani. I'm a postdoctoral researcher at Uejio. So, in the risk map, it normally provides a likelihood and a magnitude of what is the probable impact. So, in the risk maps, when you are combining two maps, uh, how is the likelihood coming into picture in those cases?
How is the what? I'm sorry.
Likelihood. So, risk normally has a likelihood attached to it.
Wow, likelihood. So again, the phase 1, version 1 of our mapping was really to just convey the contemporary environments. But in terms of likelihoods, I'd say that's where our prediction strategy, or at least the way that we provide our predictions, the likelihoods is going to become more into play here. So we take a very probabilistic approach to our predictions. So in other words, if we're just thinking about some future trajectory, we recognize that there's not only uncertainties in what humans decide to do, but also how the Earth system responds. Not just climate, but obviously everything else that's relevant to climate or is related to climate. And so our hope is, to your question, is when we begin to bring in all of our predictions, we'll have, say, a median outcome. We'll have a 95th percentile outcome. We'll have a 5th percentile outcome. And you'll be able to combine all of those different landscapes to sort of say, okay, well, here's kind of the combined likelihood of some combination of factors. So with that, just looking at the maps now, I wouldn't say, strictly speaking, there's no real indication of likelihood. It's more of, when you're looking at those hotspots, it's really just telling you that when you pool together either all the counties within one state, or you pool together all the counties across the US, this is where you sit in a relative sense, combined to all those factors. Now, one thing to your point that might be relevant is, and I didn't have time to talk about this, is that any one of those factors that you combine, you can adjust the weights. So if you covet one risk over another, those weights will be combined accordingly, and you will get a different map, and you can sort of see how the sensitivities. So in some ways that does give you a likelihood, because if you might think that one outcome or one factor is more important or is a bit, guess, more certain than others, you might weight that accordingly and get that kind of an insight.
We have a question from online.
We have some commentary and then following that up with a question, which is it's nice to see the development of these heat maps and the progress made. Also very nice work on looking at the impact in the cancer patients at patient level. The challenge may be that there are multiple health effects. Are there efforts to develop harmonized and standardized measurement tools to quantify the various effects?
Who was the question from?
This is from online.
Do you have a name?
This is from, and I'm sorry if I mispronounce your name, Kaharu Sumino.
Thanks.
The question is, are there efforts to develop harmonized and standardized measurement tools to quantify the various health effects?
Yeah, great question. I mean, I think the community has been stuck for 20, 30, maybe longer years, just even figuring out what the actual burden is, unfortunately. So, I mean, I think as we're slowly moving, I mean, I think in general health people will lean towards all cause or excess mortality or emergency department visits, hospitalizations, syndromes, 911 calls, etc. But yeah, certainly from there, we do know that you get different maps. If you look at cardiovascular versus respiratory or versus mental health risks, all of which can be exacerbated by extreme heat, but in different ways in different places. So I think, yeah, I mean, I think that would be hopeful to see in the future going forward. I don't know if I can, beyond just doing it the brute force way, I can't think of a great way to do that. Brute force being just like running that for each of those subcategories.
And I'll just add that yes, cancer has the best data, but also people very rarely present with just cancer. So it's another reason that we decided to study people with cancer. People in the sample, once we are able to grow it thoughtfully, also reported with cardiovascular disease, also reported with renal disease, also reported with mental health impacts, both prior to and resulting from the diagnosis. And so eventually, if there's a larger sample, there's also the ability to stratify by other comorbidities. And when I say most 2/3 of people with cancer have other comorbidities, it's just, it's a disease of aging. And as you age, things happen.
Thank you. Great talks. I'm Kara. I'm a PhD student at UW-Madison. And I was wondering, Kilan, you mentioned energy burden and financial impacts with patients needing to be inside for cooling. And I was wondering for all of our panelists about heat stress and financial burden from cooling and whether that is a factor that is considered in health burdens for heat.
I'll give it a start. I'll start, and you. So I will say that within our framework of our prediction system, so we not only track how emissions evolve and how energy systems will transition, say, from fossil-based to decarbonized energy technologies. Within all of that, there is a human factor, if you will, because ultimately the supply of energy has to meet the demands. And so a growing population, a changing population, even just the economic underpinnings of how you're going to assume the world will evolve depends upon demand. So while we don't have the explicit connection that you talk about right now, I could imagine that under any given scenarios, if you know something about the age of a population, you know something about the risks, health risks, or just a particular health condition, say cancer, of a certain population, the demands for energy to keep your environment cool could be accounted for. And I'm sure that you have a lot to say about the granularities of that, but that's going to be the big challenge: is how do you identify the true sort of hotspots, and where perhaps in many countries, not, I mean, we can think about, we don't have to think about this about the US. There are going to be many developing countries and poor countries that they can't even meet their energy demands now. And to your points, that could be a really important local factor to providing electricity for people that need it the most.
Good question.
That is a really good question. There are inherent limits to data types. And I think that your question just hits upon that very thoughtfully. A lot of times, especially in the initial studies of heat exposure that I was involved in, right? It's easy to go, okay, we have, especially in earth systems. I was struck, because I'm a health scientist, about just the availability of data. I literally, excuse me for a moment, the first day, like when I started my faculty position and like, you know, people were like, oh, you have to meet so-and-so. I was like, damn, like it's just, they're drowning in data. That is not always the case on the health side because of like confidentiality concerns. So I was just very struck by like the ability to be like, we're just going to study like 30 years of this phenomenon. I tried to look back at 1992, which is a long time, but like the health data is trash. Like it's bad. There's so much missingness. Like you cannot do anything.
You're not alone.
Right? Like even 2017, it's very shaky. And so when you want to look at health impacts, you're really limited by like data quality. I think the same thing is true when you think about like cooling capacity and some of these things that are just so highly individualized. And so whereas quantitative data has the strength of you being able to look like at a phenomenon on like a large scale, qualitative data has the benefit of being able to ask questions that get at how complex and messy life is. Some of the indicators that I've seen used to look at like cooling capacity would be like area level income, just assuming that like there is an ability there, right? Now you can look at air conditioning, like availability, you can look at energy usage. But the biggest issues there come down to the amount of money that someone makes versus the amount of money that they have and then how they spend it. And there's no good data source that gets at the funnel of money in, money spent on essentials, what are essentials, and then disposable income for something that is deemed a privilege like cooling or deemed an option.
I'll just briefly say, you might like Diana, I'm going to mispronounce it, Hernandez's book, anyway, from Columbia University. I think I've only read a few chapters thus far, but something like 1 out of 5 households in the U.S. face energy challenges, like when they're unable to, either in the warm or the cool season, to pay for sufficient, not just to feel comfortable, but to also stay healthy. Yeah, and then beyond that, I mean, like the U.S. Census Bureau does ask about that. There are ways to access that information, but getting that data actually out of that has been really difficult from a restricted data center. You know, in theory, it should be possible. Yeah, local governments have information about like low-income heating energy assistance programs that could be looked at too.
Sure.
All right, we have a question online from Kelly Gribben for Xingmei. Thank you for your presentation, and I apologize if I missed this. What was the definition of your respiratory hazard index?
Yes, so we actually use the respiratory hazard index from Air Talk Screen 2019. So that's the most recent version for health index. They have the exposure concentration, and you take that and divide it by the reference of the risk. I hope that answers the question.
Any other questions?
I have to say, I'm shocked that there hasn't been a question about AI, because I feel like anywhere I go these days, somebody comes up with an AI question. I think it's refreshing that we don't.
You want to discuss it? You have thoughts?
I'm actually okay not discussing it.
You have questions for each other? Or yeah.
Yeah. Oh boy. No, go ahead, Chris.
I just had one for the audience.
Sorry.
there's like, just one for the audience, but others, I know that many of you also have experiences with heat as well as compound events. So just curious what your experiences are. Not okay to call Megan and Chelsea and others.
Okay. Thanks, Chris. So I work in the New Mexico Department of Health. And one thing, so we always, it gets hot, right? It's New Mexico. We always put out the press release, which seemingly comes earlier and earlier every year. And like now we're in trying to put it out in March of, it's starting to warm up. This year, even March was too late because in February, it was already hitting 80s. In the first press release too, we say, if you need assistance with cooling bills, electric bills, here's the link. Because that is definitely also an issue. We have a lot of people below the poverty line. 23 and 24, we definitely had heat was the main thing. This summer we got heat and wildfires and floods and everything all at once. And so that is still definitely a challenge, figuring out the messaging and what is realistic. If there is a wildfire happening and it's really hot, then, how to do that. Or then if it's flooding in the place where it hit 80s in February. So I was very curious to see this session because it's not just heat, right? It's always the compound events part of it. And I'm very excited to check out your map because I think we will be using that.
And love to hear from you.
I love to provide feedback, so this is great.
I can speak just from a local government. My name is Megan Hale. I'm the sustainability manager for the city of Norfolk, Virginia. So this is pretty far outside of my typical scope. I'm more of a generalist, but Chris and I will be working together and really studying the impacts of heat on our local government. So, and your question about heat burden was an interesting one. So we have some data points, particularly in our disadvantaged communities. They're spending a good deal of their income on typically cooling in our area. We're also tracking at the municipal level our energy consumption. So we have a good amount of data that goes back about 10 years for our buildings. So we are tracking that, and that's sort of the uptick with cooling in our rec centers and our libraries during these heavy heat days. We're seeing on those bills like a big uptick, and we're trying to work as a community to plan ahead so that we're not caught off guard. So we're looking at resilience, communities, resilience hubs where we've got solar, battery backup, cooling in neighborhoods that really truly need it the most. So happy to be here, learning a lot from you all. Thank you so much.
Thank you. All right, so about at time, I think. Thank you. Thanks to the panelists for doing an awesome job, and thanks to the students who are helping keep everything going.